I just had to have a pretty tough conversation with a family member. They have a father that needs to go into a nursing home. And so one of the things I asked, and this is one thing that I want to make sure everyone out there understands, is the fall risks in nursing home. If you're looking for assisted living facility, a continuing care facility, a nursing home, long-term care facility, I understand, can't help it. But very few companies address the fall issues. A typical nursing home with 100 beds has over 200 falls annually, and most of those go unreported. 2/3 of those that fall in a year will do so again. And most of your fatal injuries that come from falls happen in those that are 75 years and older. I've read all these studies, and I don't know for the life of me, with unintended injuries, falls being number one category, the number 3 cause of death for those 65 and older, or unintended injuries, falls number 1 in that category. Why folks don't talk about fall prevention when they're looking for in-home health care or a CCRC? That needs to be at the top of the priority list. What's above that? Well, staff, turnover, all your regular questions. But if you're not asking what your in-home healthcare company is doing for fall prevention and how they're going to prevent your loved one from dying from the number 3 cause of death, especially when you have over 10,000 Americans turning 65 every year, and more people are looking for alternative places to grow old. And then you need to start asking yourself, as you're looking for your loved one, what home healthcare companies, what in-home healthcare companies, what are they doing for fall prevention? Balance University is a place you can turn to if no one is doing anything about it. There are a couple of companies, especially here in Naples, there are a few companies that actually will put their staff through fall prevention workshops. I've done them. If you want to know who they are, give me a call, 239-287-5376, or you can email me at emeritushealth@yahoo.com. I'll get you the list, and I'll include the sources to all these studies in the description below. Have a great day. Hope this helps.